Hi friends, good evening and welcome to my channel Mookambika Nursing. Friends, in this video we can discuss some important questions for coming exam. First question we can see, a rapid administration of blood containing citrate may cause. Options are option A hyponatremia, option B hypocalcemia, option C hypernatremia and option D hypercalcemia. Correct answer is option B hypocalcemia. Rapid fast administration of blood containing citrate content may cause hypocalcemia. The next question, content of Dettol is. Options are option A chlorhexidine, option B chlorosilinol, option C chlorcycline, option D none of this. And the correct answer is option B chlorosilinol is the content for Dettol. It's an important question. Okay, and the content of Savilon is chlorhexidine. Content of Savilon is chlorhexidine. Dettol is chlorosilinol. The next question, the instrument which is used to determine the depth of the anterior chamber angle of eye is known as. Options are option A gonioscopy, option B fundoscopy, option C ophthalmoscopy and option D none of this. Here correct answer is option A gonioscopy is an instrument which is used to determine the depth of the anterior chamber angle and also to examine the entire circumference of the angle of eye. That is known as gonioscopy. Okay. Option A is the correct answer. And the very next question, most common form of arthritis is. Options are option A rheumatoid arthritis, option B osteoarthritis, option C childhood arthritis and option D gout. And the correct answer is option B osteoarthritis is the most common form of arthritis. These all options are the type of arthritis. Okay. In this, osteoarthritis is the most common form of arthritis. The next question, fetal circulation is fully functioning by. Options are option A 10th week, option B 12th week, option C 14th week, option D 18th week. So when is the fetal circulation will function fully? That is the question. So answer is option B 12th week. By 12th week the fetal circulation will function properly. That is after first trimester. Okay, by 12th week onwards. And the next question, Khan test for syphilis is an example for. Options are option A comb test, option B slide flocculation test, option C tube flocculation test and option D agglutination test. Here correct answer is option C tube flocculation test. Khan test which is used to diagnose syphilis is an example of tube flocculation test. And the next question, the diagnostic test which is used to assess vascular abnormalities in the temporal bone is known as. Options are option A tomography, option B audiometry test, option C arteriography, option D audiography. And the correct answer is option C arteriography. The question itself it is there, vascular abnormalities in the temporal bone is known as vascular related to blood, that is known as arteriography. Option C is the correct answer. The next question, sudden muscle contractions of varying intensity that may involve a small part of one extremity is known as. Options are option A dystonia, option B akinesia, option C myoclonus, option D tremors. Our question is sudden muscle contractions of different intensity that may involve the part of the body. Maybe it is one extremity or the entire extremity, that is known as myoclonus. Option C is the correct answer. Here the sudden muscle contraction which may occur either one extremity or the entire body, that is known as myoclonus. The next question, loss of sense of three-dimensional discrimination is known as? Options are option A agnostics, option B stereognosis, option C paresthesia, option D hyposthesia. Okay, here correct answer is option B stereognosis, that is known as loss of sense of three-dimensional discrimination. Last option hyposthesia. Hyposthesia means reduced sense of touch. And the next question, inability to identify symbols traced on the palm when the eyes are closed is known as? Options are astrognosis, option B paresthesia, option C hyposthesia, and option D agraphesthesia. And the correct answer is option D agraphesthesia is the inability to identify the symbols traced on the palm when the eyes are closed is known as agraphesthesia. The next question, KH questionnaire is used to identify the severity of. Options are option A schizophrenia, option B hallucination, option C alcoholism, and option D eclampsia. Correct answer is option C alcoholism. KH questionnaire is used to identify the severity of alcoholism.